Have you ever wondered what happens after death? Deep hypnosis opens up the most amazing soul memories of a spirit world that awaits us all. Follow the fascinating journey of 15 ordinary people in the book Exploring the Eternal Soul who have been regressed beyond a past life into the afterlife.
Hello, welcome to the Spiritual Regression Show on moretalk.tv. My name is Reena, and I'm the Director of Divine Aspect, a therapy practice based in Dorset, UK, focusing on regression therapy, life between life therapy, hypnotherapy, and life coaching. Today I am joined by Andy Tomlinson, a pioneer of regression therapy in the modern world. Andy is the director of the Past Life Regression Academy, and he trains regression therapists all over the world in Europe, Asia, Australia, Africa, and soon in the US. Andy is also the author of 2 books, Healing the Eternal Soul and Exploring the Eternal Soul. We are also joined today by Graeme McAndrew. Graeme is a registered mental health nurse and has been for 9 years. He is also an alternate therapy practitioner based in London, UK. Hello, Andy and Graeme, and welcome to the show. Andy, could you just let us know what regression therapy is?
Well, regression therapy is about going to the source and resolving a person's problem once and for all. The analogy is a little bit like getting a thorn embedded in the skin. People could either put a sticking plaster over it, which would heal to some degree, but the thorn would still be in there giving discomfort, or you can go in and completely remove the thorn, and then when the healing takes place, it's completely healed. And this is a little bit like how regression therapy works. I'll illustrate this with an example of a case study I had. This was a lady aged about 35 who was a hypnotherapist, and she had something that she called a phobia, but it's the most extreme phobia I've ever heard about. It's probably more like post-traumatic stress. And she told me it had started when she was 5, and she saw some of her friends who had perhaps hurt themselves, and just looking at the sight of blood, she fainted. And this progressed to the time when she went to a cinema and there'd been a rape on the screen, and she tried to run out and fainted in the foyer. She would, if she saw someone pregnant, for example, she would faint and collapse on the floor. And if there was a mention of hospital, the thought of going to the hospital would cause her to faint. And if she ever heard the word abortion, even just thinking about an abortion would cause her to faint. So this was an extreme reaction that she had. And remember, this is something that had been happening to her for most of her life. And as a result, she was almost a recluse. Even though she was a hypnotherapist, she had to be so careful not to pick a client who was going to be pregnant or would even talk about pregnancy. They're very, very restrictive. So using regression therapy, we went to the source of the problem. And for her, it was a past life where she'd been a young girl who'd become pregnant, had gone to a backstreet abortionist, and they'd made a hash of the job. She'd bled profusely and died in the street in a terrible state. And working with her, because of the sheer amount of fear that she had, sometimes this work can be done in one session, but for her, I had to do it over 2 sessions. And just to give you a little bit of an idea of some of the ways that the healing took place, is that just remembering the cause is just part of it. I work with people's higher minds. So she was able to tune in to the higher mind of the abortionist and was able to express her displeasure of what had happened. And she was able to meet the baby, certainly the higher mind of the baby, and enter into a dialogue. And then eventually she drew the baby to her, put her arms around the baby, and tears were pouring out of her eyes. It just been able to be reunited with that baby in the session. And as a result of that, her life turned around completely. The phobia went completely. And I had a photograph from her some weeks later where she was in hospital holding the baby of one of her friends for the picture that she'd taken. So this is an example of regression therapy. Really, it brings together the very best regression techniques from psychotherapy, things like inner child regression, clinical hypnotherapy, body therapy. And it also introduces spiritual approaches, such as working with past lives, bringing in spirit guides, and transpersonal experiences.
So the fact that it's more fully embodied as a therapeutic model makes regression therapy different from past life regression? Can we say that?
Yes, there's some very big differences. I think the first difference is that regression therapy is something that works with voluntary regulation. What that means is 15 years ago, I worked together with all the leading regression therapy schools across the world, and we agreed a standard of the content and the type of training that would go into what's called regression therapy. And that means that there's professional training that not only includes working with past lives, but it also includes current life work and a lot of the psychotherapies that we've been talking about before, all combined together. Past life regression, on the other hand, is something that's unregulated, and people can even go through to a correspondence school and claim to be a past life therapist. You know, and if someone's going to go through and, for example, if they're going to a hospital and they're going to have brain surgery, they would want to go to a brain surgeon that was working to professional standards, that had been fully trained. They certainly wouldn't want to have someone who'd had nothing but correspondence training to go through and pick up a scalpel and to work in surgery on them.
So in your view, why would someone go for past life regression therapy, and why would someone go to do a past life regression session?
Well, people would come for therapy when there's some particular problem that they want to go through and work with. A lot of the clients that I get are ones that have tried other therapeutic approaches, and their symptoms may be reduced, but the problem actually hasn't been fully resolved. You know, in the world of working with past lives, quite often that's a way where the problem can be fully resolved, a little bit like the lady who had the abortion. But sometimes a lot of the work has to be done in the current life, and a lot of the psychological problems people have happened because of traumatic things that have happened as children, in which case there isn't a need to go into past lives, and the whole focus is about resolving the issues that caused the problem to bring about the therapeutic change.
Graeme, you had a past life regression therapy session with Andy, didn't you?
Yes, yeah.
Yeah, so could you let us know why you decided to seek therapy, and what was your experience like, and what was the result?
I sought the therapy because for the issue that I had, the medical practice, the medication that I'd been given and the injection that I'd been given for the problem weren't alleviating it at all. In fact, in some ways it was making it worse. So I just sought an alternative way of trying to address the problem. So this was to do with my back, and there's a couple of discs that have popped out of place, and they're pressing against my spinal cord, giving me nerve root damage down my left leg, lots of spasms, and I was put on medication for this, and basically being told that only time will relieve this condition. So to address it through regression therapy, I actually had two past life regressions around this issue. What it's left me with is I'm no longer on medication. I've been off medication now for a year, so I'm not taking any pain relief or any anti-inflammatory medication at all. My mobility is back, my flexibility is back, not to what it was before the discs popped out, obviously, but it's back to a way in which I can actually move around without pain, and I can actually sleep without pain as well, which is quite a relief.
Ah, that's brilliant. So Andy, can you just give us a brief history? When did past life regression therapy start, and how it basically has become this modality that we know of now?
Okay, well, working with past lives and healing with them has been known for quite a long time. I mean, even as long ago as 2,000 years ago in India, the yogis there were using past lives to help resolve people's problems. But it was probably only about 30 years ago that this whole approach of working with past lives came through into the Western world. In the US, this was with Morris Netherton, and in the Europe, it was with Hans Tandem and Roger Wolger, all of them pioneers of this particular work. I think one of the things that was in common with all of them was a passion to bring past life therapy into a deeper profession rather than just simply exploring past lives, which is really what happens with people that haven't had comprehensive training. And it was through their efforts that past life regression was actually taken a step further. And we tend to refer to it as regression therapy now, because past life therapy is just part of the approach needed to resolve people's problems. In the case of Graeme, this was unexplainable pain. In the story that I talked to you about, this was an emotional issue of fear in an extreme sense. Really what happens is that as souls, we take on life lessons sometimes that are too challenging. And we have energy blocks, and these energy blocks are associated with the emotions. And what it does is it tends to weaken parts of our body, and it's easier then for other illnesses or diseases to come through. In the case of disease and illness, it can ultimately be open the door for cancers and other more serious illnesses. Or people may spot it in terms of reoccurring emotional problems, that they call depression, or they call anxiety, or they call it post-traumatic stress, or they call it obsessions. The names aren't quite that important as it's an emotional issue. And regression therapy often resolves it in 1, 2, or possibly even 3 sessions. It's very, very quick, very, very powerful.
And you train regression therapists through the Past Life Regression Academy. What
Yes.
elements do you teach people within the regression therapy modality so that they can go through and help clients with these challenges?
Yes, I mean, the training program that I use is part of the European Association of Regression Therapy, which was the association I mentioned before, which regulates the whole of this particular therapeutic approach. And the students who come through my training in the end up with a diploma in regression therapy, which is recognized by the Earth Association of Regression Therapy. So it's a complete program, and people are interested, they can look on my website and get more information about it. It's www.regressionacademy.com.
Thank you. We also want to find out whether past life regression therapy or regression therapy, can it be integrated with other forms of therapy to provide a client a holistic healing experience? Or should it just be used by itself?
Okay. Do you want to take that?
Yeah, I mean, I think it can be used by itself or it can be integrated. I'm actually starting to integrate aspects of regression therapy into the work that I do as a specialist child and adolescent mental health nurse. So I think, you can use it in its entirety just as one kind of discipline, or you can take aspects of it and integrate it with other things that you already do, and indeed start to create even newer ways of working.
We're going to continue after this break, so stay tuned and we'll be right back.
Healing the Eternal Soul is a book sprinkled with case examples that makes it an invaluable resource for those who assist others in achieving contact with their eternal part. It lends hope to those whose lives are stuck or riddled with painful residuals from past lives. More so, it's an incredibly interesting read.
The Past Life Regression Academy teaches hypnosis, past life regression, regression therapy, and life between lives regression internationally. Hundreds of students have been through the Academy training program and have successful practices. This is because of the amazing results they get and the referrals that come from it. For more information, see the Regression Academy website.
Welcome back. We are joined by Andy and Graeme, and Andy was just telling us this fascinating story about how a medical doctor in Singapore had used regression therapy to help a patient with phantom pain. Could you please continue the story, Andy?
Yes, as I'd mentioned before, this person had all this surgical treatment, but the phantom pain was still there. And when Peter did regression therapy, he found that by regressing her to the time when her hand was crushed, there was a lot of anger that she was holding about what had happened. Once he'd released the anger, cleared it and transformed the memory, the phantom pain went. So that's kind of like an interesting way in which regression therapy and traditional medicine work quite harmoniously together.
And also, Graeme, you were talking about your own experience that your back problem was healed or went with regression therapy. So I'd just like to ask either one of you, how is the medical world reacting to regression therapy? Maybe Andy could go first, and maybe then Graeme could take it as a registered mental health nurse.
Yeah, a little slowly, to be perfectly frank. I think because some of the terminology, like past lives or spiritual approach, don't quite fit into an approach which is really taught that the body and the mind are completely separate, because the traditional medical approach is to treat the body as if it's a separate part. And that's why a lot of the treatment is either surgery or it's with giving pharmaceutical medication. And as a result, it's to introduce that approach that actually you have to treat the whole person, the spirit, the mind, the emotions, and the physical body to bring about healing is quite a challenging transformation. And one of the things that I was quite actively involved with about a year ago was bringing together medical doctors from around the world who use regression therapy and forming an association, which is called the Society for Medical Advance and Research with Regression Therapy, SMART, and to undertake a series of research projects so that the results of the research done by medical doctors can be published in medical magazines to start bringing about the change. I mean, we know that when amazing stories come out from medical personnel like Brian Weiss, it's very easy for the medical world to dismiss an individual as being a bit unusual. But when a whole group of medical doctors have exactly the same findings, then it's harder to dismiss. This is called the bunch of sticks technique, that it's very easy to break one stick, but when you put a whole group of sticks together and try to break them, then they're a lot stronger. So there's two pieces of research that are being undertaken. One of them is with chronic pain. This is for pain that doesn't have any obvious medical explanation, and yet is very real and causes a very significant impact on the person. And to show how regression therapy can resolve it. I mean, Graeme's talked about his personal experience, and there was a story of Peter Mack, but this needs to be put into a framework where it can be formally published in the medical magazines. And the other piece of research, which is quite fascinating, is to use MRI scans. This is apparatus that allows the operators to actually see inside the brain. And one of the research projects they want to work with is with social phobia. This is a condition when people are very fearful about leaving the home. But it's been found that it's quite easy to spot the parts of the brain that have this problem. And when the problem's been resolved, then the brain changes can be seen up with the MRI scan. So then through this research, it's possible to see the effect of regression therapy, of working with past lives. And instead of people just reporting that the emotions have gone away, then through the MRI scan, they can clearly prove that there's been a physical change.
Yes, and then that would make the evidence far more credible, wouldn't it?
It would be, because it's bringing it then well and truly in the area of physical things before and after therapy.
And Graeme, you're a registered mental health nurse.
Yes.
Do you use this form of therapy in your mental health practice? And
I
if
use
so, how
I
do you
use
do
aspects
that?
of it. So I use what I deliver it as relaxation therapy is the term that I use. Typically, if I start talking about regression therapy, as Andy's already said, the words can mean a lot of different things, and it's not always accepted. So in general, I call it relaxation therapy, and I've integrated what we call colour therapy and emotrance, as well as emotional bridges, as a way of children and adolescents, young people, starting to tune into their emotions. So quite often, children and young people, they don't have the vocabulary to be able to say what's happening for them, or why they might be behaving or thinking in certain ways. So I find that some of these techniques, such as the emotrance, colour therapy, and emotional bridges, work really well, helping the young person or the child to just relax and tune into that feeling, and then they can actually verbalize or vocalize what it is that's happening for them. There's a lot of confusing thoughts and feelings for children and young people these days. And this is a way of really helping them fine tune exactly what that thought is, what that feeling is, and being able to then say what the problem is, what the issue is, and get into the core of the problem. So we're not having to go back slowly, slowly, slowly. We can get right to the core of the problem. So they're getting, their treatment is a lot quicker. They're coming out with their symptoms are diminishing a lot quicker than they would have normally with something such as CBT, cognitive behavioral therapy, which is another modality that I deliver as well. So that's the way that I've brought it into the practice, doing it very, very, very slowly, but calling it relaxation therapy or relaxation techniques.
So basically, this form of therapy it helps clients get past their issues and challenges a lot faster and also slightly deeper. Is that what you're saying?
Yes, and they're also not having to talk about every little last detail, which I think is really important because not everybody wants to re-experience all the traumas or all the difficulties they've gone to. So if you can jump some of those and go to the core issue, quite often what you find is that the other difficulties that came from the core issue over time, they're dealt with because you've gone to that first point of trauma.
Got it. Oh, very interesting. So how do you get someone, I mean, either Andy or Graeme can take this. How do you get someone into this form of therapy? Does someone just close their eyes and remember a past life? What's the process of getting someone into a past life?
A lot of the work that we do involves people going into altered states of relaxation. They can do that with traditional hypnosis. They can do that by just focusing on the symptoms, and by focusing on the symptoms they'll go into an altered state, and then very quickly they can be directed to the source of the problem by the therapist. It's a little bit like a computer that has some file in it that's been damaged. With the right command, you simply go straight to that file where it can be repaired, and once it's been repaired, the computer will work afterwards exactly as it was working before.
Right. And Graeme was also using terms like emo trance and emotional bridge and color therapy. Do those involve getting patients or clients into a trance state as well? And how is it different from hypnotherapy?
Well, hypnotherapy is a very broad term, and I think it's very well established now and accepted by the medical world. These are just different ways in which hypnosis can be used. I mean, a lot of the readers may not be familiar with the actual techniques, and of course they don't need to be, because the therapist will use whatever technique is most appropriate for that particular situation. I think what Graeme was illustrating was how when people have been trained and they have a whole series of possible tools to use, they'll use whichever tool is the most appropriate one for the client's problem. It doesn't really matter what it's called. However, we have been using the word generally regression therapy rather than hypnotherapy, because a lot of hypnotherapy is around using suggestions with hypnosis, which is very powerful, but it doesn't actually go to the root issue. And whatever the technique is, then regression therapy is around going to that root issue, the thing that caused the problem, and fixing it so that all the symptoms go away completely and people can get on with their life and engage it in a more meaningful way.
I've actually heard a case where someone claimed that they went for, it wasn't so much regression therapy. They said they went for a past life session, and it was one of their family members, and that family member came back worse than before. Is that possible when we're doing past life regression therapy or past life sessions, that someone could go to it and come back worse?
Well, I mean, it's possible if someone goes to a medical doctor who's not properly trained that gives the wrong medication, then they come back worse. Or if someone goes through for surgery and the person hasn't been properly trained, there may be complications. As long as people are going to professionals who've been trained, who are in a professional association that has a code of ethics, they're perfectly safe. I mean, the training that all of the therapists that come to my training school, and certainly all the other ones in the Earth Association, are trained to guide the person to the source of the problem, so that the problem is resolved, so that there's no complications afterwards. And, unless you enter into a world where there's state regulation, which is a possibility, then there will always be some people who claim to be able to resolve people's problems, who haven't been properly trained. So unfortunately, it puts the onus on the general public just to be careful and vigilant before they come through for therapy. One of the great ways to do it is to look on a professional website, or to get referrals from someone who's already had some work and can vouch for the person. So as long as they have some vigilance, it's a perfectly safe therapy, because the therapists have been trained professionally to do the work.
So for our viewers and listeners, right now, where would you direct them to go to a database maybe of professionally trained therapists that you could vouch for?
Well, I would suggest that they go to the Spiritual Regression Therapy Association website, and that is www.regressionassociation.com. And they'll find therapists from around the world that will be able to go through and help them in the area that we've been talking about.
Okay. And the other question I have basically is, when someone does past life regression therapy, there is no fear that they will stay there and not come back in that experience or in that emotional experience.
Well, no more so than someone thinking about something that happened early on in their life, perhaps when they were 4 or 5, getting stuck there. We can bring our memory back to the here and now at any time we wish. When people are experiencing hypnosis, or when they're experiencing past lives, if they wish, they can stop and immediately come back to the here and now and sit up. They have that power and ability to do that. What I tend to find is when people are experiencing past lives, they're just fascinated by the story that emerges, almost like they're a distant observer. And I think this is one of the things that is probably worth pointing out to the public about past lives, that some of the things that help people think that the past life is real is that sometimes emotions or sensations come through at the appropriate part. After the session, they remember the whole of the past life. And in fact, they find once they've left the session, other little bits of the past life come through, which is totally different than stories that are made up. And they often like to go through and tell their friends about it, quite proud of the experience that they had.
Okay. And when they go through their past lives, just let me know whether they're actually altering what's happening in that past life. So basically, I'm just asking how the mechanics of it works. And perhaps this is something that we can talk about after the break. So for everyone who's watching, stay tuned, and we shall continue our conversation with Andy Tomlinson and Graeme McAndrews.
Have you ever wondered what happens after death? Deep hypnosis opens up the most amazing soul memories of a spirit world that awaits us all. Follow the fascinating journey of 15 ordinary people in the book Exploring the Eternal Soul who have been regressed beyond a past life into the afterlife.
The Past Life Regression Academy teaches hypnosis, past life regression, regression therapy, and life between lives regression internationally. Hundreds of students have been through the Academy training program and have successful practices. This is because of the amazing results they get and the referrals that come from it. For more information, see the Regression Academy website.
We're back now with Andy Tomlinson, who is going to talk about the mechanics of past life regression. Because I was just wondering whether when someone goes through past life regression therapy, whether we are actually altering the reality of the past life.
Well, the simple answer to that is the therapists are trained to ask open questions. So the sort of questions that they would say is just describe what's happening. What happens next? Describe your clothes. Describe what's happening around you. So in other words, the story unfolds exactly as it actually happened. And it's certainly true that as part of the transformation of the story, they may decide to change some aspect of it to bring about healing, but the original story is never forgotten. Maybe it's better if I illustrate it with a case study. This was a lady who had helplessness, and she had aches and pains all over her body. And when she was telling me her life story, when she was a child, she'd been brought up in an abusive family where her father was drunk and used to be physically and emotionally difficult towards her. She left as soon as she could, got into a relationship with her husband who used to be psychologically abuse her. And then she'd had a whole series of boyfriends where she was like the victim in almost like a learned helplessness of the situation. And when I took her to the source of the problem, she went into a past life in Victorian England where she'd been a child that was an orphan that had been taken into a workhouse, and workhouses in Victorian England were people were treated very poorly, just barely enough food to eat to survive. And she'd left at a young age to work in a laundry where she was working around about 14 hours a day with a pot of clothes where she had to stir them and take clothes out and put new clothes in. And eventually she was found by a rather wealthy gentleman who took a liking to her and ended up marrying her. And she thought her life had changed completely. But it turned out that this particular businessman took his frustrations out on her and used to beat her. And she didn't know what to do because she didn't have any family to go to. She didn't have any money. And if she went through and told anybody, who would believe her, an uneducated girl, against someone who was a very successful businessman, a pillar of society? So she just had to take these beatings. And eventually she fell down some stairs or was pushed down some stairs and had bruising all over her body, was dragged into a cellar, and there she died. She died with pain all over her body and this feeling of helplessness. And what had happened is that as a soul, she'd chosen to have a series of similar situations so that she could find a way of resolving it. And she hadn't, because each situation she had in the current life with her father, her husband, and her boyfriends, it was repeating the pattern, yet she wasn't able to break out of it. So part of the therapy that I used with her when she was in the past life of being the Victorian girl was to allow her to change the story. And I used a little bit of body therapy where she was allowed to push the man away, and she was able to use her hands against the pillow so she could feel him being pushed away, which is very, very powerful for someone who experienced helplessness to actually express it physically, and was able to shout and to kick. And that released the emotional charge, and she was able to eventually come to some resolution with the higher self of that person. And that part was completed. Then I went to a current life, and we repeated the same sort of thing, meeting all of the people who had abused her, discussions with the higher self of them, till she was able to come to a resolution and was able to eventually find forgiveness for them all. And then finally, and this was over 3 sessions, at the end of the last session, she was able to express to the higher self of the current boyfriend and say the words, "Treat me well or leave me." And then immediately went out, said those words in a real life situation, because a lot of therapy is about bringing things into the here and now. And she was able to say those words. For a lot of listeners, they may think, well, but that's quite straightforward, isn't it? But for someone whose entire life is helplessness, never able to express what you really want to say, that was a mountain she had to climb. And she did it. And he left. And her hopelessness disappeared. And all of the aches and pains on her body disappeared. And, she'd been able to re-experience the memories in a different way. She could still remember the past life story as it was. She could still remember the current life memories as they were. But because the emotional charge had been discharged, it meant that it was just a memory. It didn't hold any power over her. And she was able to then engage in life in a meaningful way.
So you're not really altering the reality. What's happening is you're taking away the emotional charge from the memory.
Yeah. I mean, some people could even describe it that she was recreating a new life situation for a soul to actually experience with the help of the therapist to do the things that she always wanted to do. However you describe it doesn't really matter, is that for her, I like to draw the analogy of log jams. These rivers where they chop down trees and they float the trees down the river, and then there's a natural flow as the logs go along with the river. But if something goes wrong somewhere and some logs get into a log jam, the whole of the river gets blocked. None of the logs can go past it. The water gets stagnant. And it's a little bit like this when we get an emotional blockage. And the art of the therapist is to help the client pull out one of the logs near the bottom. And once that log's removed, the force of the water will flush away the remaining logs, and the river then can continue running just as it did before. And it's the same sort of approach that's used, that with changing the nature of the story, allow people to remove these charges, in this case by engaging the physical body, which is called body therapy. Then the emotional charges get removed, the life force of the person can then get fully engaged, and the problem gets completely cleared.
But there are people out there, Andy, who talk about false memory syndrome and how therapists implant these memories into the clients or onto the clients during the session. What do you say about that?
Well, it's true in really all professions. I mean, I know in the area of police, they're trained very carefully with the sort of questions to ask witnesses. For example, if there's been a bank robbery, they'll say, and what color, and what did the robbers do? And the client may say, oh, well, they got into a car and drove away. And then they would say, okay, and what color was the car? So in other words, they're asking questions. If the policeman said, oh, and they drove away in a blue car, didn't they? They could be implanting a false memory in the witness's mind. Remember, the witness isn't in trance. This is just during normal conversation. Mm-hmm. So the whole art is to ask open questions and to flow with it. And as long as people are trained professionally to do that, then false memories can't be created. And I think this is the important thing, that this isn't a problem, as far as I'm aware, with any of the people that have been trained in any of the schools that belong to the Earth Association of Regression Therapy.
And how about confabulations? So some skeptics say that the clients are not experiencing a real memory, but they are piecing together pieces of fantasy bits. Maybe they've taken some information from television, they've taken some information through books, maybe through talking to clients, and in the session they confabulate the experience. What do you say to that?
Well, I'll tell you about the very first client that I had for a past life regression. Mm-hmm. I just completed 4 years of psychotherapy training, and which hadn't included any work with past lives. And I had an elderly lady came to me and said, oh, I think I would like to experience a past life. So I thought, well, okay, I'll try. I wasn't proposing that it was any form of therapy because I hadn't been trained professionally in it, but certainly just to allow her to experience a past life. And she'd mentioned before how she was fascinated with Venice. Mm-hmm. And I didn't really make the connection with that particular comment at the time. Mm-hmm. And when she went into the past life, it turned out that she was a keeper of prostitutes. In other words, she had people working for her that were prostitutes in Venice. Mm-hmm. And in that time, she was shunned by everybody, the lowest of the low. And when I finished the past life, and as this was the very first past life I had, I was expecting someone to say, wow, that was great. And the first comment she had was, don't tell any of my friends. I don't want them to know that I had the past life of being a madam of prostitutes. So there was certainly absolutely no way that she was making up a story herself. In fact, if anything, if she'd have had some sort of creativity in the process, there would have been a past life completely different. And this is one of the things that happen with past lives when they emerge. It's almost like the person's conscious mind is an observer and the story just emerges by itself. And often a lot of lives are short and harsh because that's what a lot of lives were like a few hundred years ago.
I'm just going to draw Graeme in, because Graeme, you had your own experience. So yeah. How did you know that it wasn't something you confabulated?
I think just the content of the past life and how I was then able to integrate it with the information that I got from that past life into current life situations. So just talking about the sessions that I had around my back problem, there were two different sessions that I had, and they were very, very different past lives, but each one had symptoms of what I experience now, if that makes sense. So one was more about the injury itself and I suppose the body memory of the injury. The other one was more about the ongoing pain that I was experiencing because of the injury. Also, within the second past life, there was a knowing in there that I'd met members of my current family in that past life. And that was just a knowing, that isn't something that the therapist tells you when you're undergoing the therapy itself. There's certain knowings that they just come. That's the only way I can explain it. They just come, and they're like light bulb moments, really. So those are the times when you really know that this isn't a story that you're making up. Also, when you're under hypnosis and going through the past life, you're not that much in a trance that you don't know what's going on. You are questioning this yourself as well. You're kind of questioning, is that real? Am I making this up? But actually the story takes on a kind of life of its own. It just flows. So it's not something that you're forcing, that you're creating. It's something that just happens and it unfolds in front of you. At least this is my experience. It unfolded in front of me whilst I was, undergoing the session, really.
Well, thank you. How fascinating. So before we leave, I'd just like to ask Graeme to maybe tell the audience and the listeners, if they were thinking about coming for a session, what would you say to them to make them feel more comfortable about trying regression therapy?
Okay, I think that I would say initially there's nothing to worry about. There is nothing to get anxious about. You're in total control all the time. A good therapist will take away any worries that you have when you walk through the door and meet that therapist by answering any questions that you have about hypnosis, about past life, what regression is, how it's going to feel. And it is a very personal experience. What I feel might be different to what somebody else feels. But the most important thing is that if you want to transform your life, if you want to make that change and you're motivated to do that, regression therapy is one of the I guess just quickest ways in the way that it does transform your life. It's one of the quickest ways to go through that transformation. It's one of the quickest ways to get to the core of the issue and deal with it. And it's not being dealt with in a long, drawn out way that some talking therapies deal with situation. It's done in a very gentle way. It's done in a way that you can manage. You're contained very well by the therapist. So I would just say, if you're thinking about it, do it. Don't hesitate. Just go for it. It's one of the most amazing therapeutic interventions that I've experienced.
That's all the time that we have for this show today. Thank you so much to Andy and Graeme for joining us, and thank you to everyone for tuning in. For more information on Andy Tomlinson and the Past Life Regression Academy, please go to regressionacademy.com or regressionassociation.com. For more information on SMART, please visit smart.com. For more information on Graeme, please visit symbioticahealing.com. And for more information on me, please visit divineaspect.com.
Healing the Eternal Soul is a book sprinkled with case examples that makes it an invaluable resource for those who assist others in achieving contact with their eternal part. It lends hope to those whose lives are stuck or riddled with painful residuals from past lives. More so, it's an incredibly interesting read.